What are you doing?
What?
You keep leaning for. Trying to fart?
I'm trying to. It won't come out. I feel like I have to, but like, I don't know.
Do it
Maybe
in
I
my
don't.
fucking expensive chair.
Oh, okay.
So welcome back for 21. We didn't do an episode last week, obviously. Only because there's only one thing to talk about. And we all know what that is.
Wish I didn't know what it was.
I know.
I'm tired of it. I mean, you can't. You like
This
try
is
to
episode
forget
21,
about it.
by the way.
You said that. You said
Did I?
welcome to
Whatever.
21. Like you don't
My
even know
mind,
what you're talking
no,
about.
my mind is so fried over this shit.
So what are you gonna do? Babble for the next half an hour?
Yes.
Wow.
Speak.
What?
Ola.
What was I saying? Oh, we have a visitor.
Oh, that's something about the fucking virus.
And there she goes again. What?
Something about the virus.
No, oh, you try to forget about it for 5 minutes and then you like think everything's normal again and then it just wiggles its way back into your mind again and you're just like, oh, God, it's still here.
Knew this is gonna happen.
Yeah. I just didn't, I don't know. I don't know what I expected. I really don't.
Oh my God. Seriously? I opened the door and she just stares at me like I'm an idiot.
Well, then she can just stay in here with us. That's her problem.
Hey, I tried. Don't look at me like that.
No, now I think she sees herself in the mirror. That's pretty funny. She's like, wait, there's another dog here.
Hello.
Oh.
But yeah, it just grinded everything to a fucking halt.
That's what I said. I was talking to the one cop that came in today. And that's what I said, it is affecting every single aspect of your life.
Yeah.
Everything.
Yeah.
It really is.
The only people benefiting from this are the ones that can stay at home and be creative from their own home. Like YouTubers and streamers and like painters and stuff like that.
Yeah. Painters.
Yeah, people paint their home all the time. People can get creative as fuck during this.
Oh.
That is one positive. There's going to be a lot of creativity to come from this.
A lot of cleaning.
A lot of cleaning. There are positives that will come out of this. Like, for instance, our economy is going to fucking explode after this.
I hope so.
So many people are going to go out. Once people have money again, once they're back to working, everything is just going to explode.
No, I'll bet you people aren't going to complain about being at work for a while.
No, I guarantee not.
Except us.
Well,
we can because we're still working.
I mean, unfortunately, is what it is.
It's just hard because you're right. You're out in the line of fire. You're standing there. You're vulnerable. You know more than likely you're going to get it, and you can't do anything about it if you don't want to lose your job.
We're better off becoming infected now before it comes back in September, October. Because when it comes back, it's supposed to absolutely decimate our medical system.
How?
Because it's going to fizzle out because it's going to get warm. It's going to be summertime soon.
But where's it going to start back up?
It's just going to re-outbreak again
from what?
All over the place.
What? It's just going to come out of thin air?
Well, you're going to see less and less people become infected, so it's going to give almost an illusion of, hey, the virus is going away. They're going to begin opening stuff up again, and all of a sudden it's going to come back in flu season and just have a way worse outbreak than what it is now.
Not this. You mean it's going to hit the world again?
Yes. The HHS report sent to the White House predicted 18 months with multiple outbreaks.
Oh my God. So we may be potentially doing this again.
Yes. Spanish influenza lasted for 4 years.
Oh, dear God.
The flu pandemic of 1957 lasted for 2 years.
How? Because it just wouldn't die?
Yes.
Oh my God, this is ridiculous.
But you do got to remember that we beat the bubonic plague and Spanish influenza without any kind of medication.
Well, there isn't medication for this one either.
No, but you can fight it with antivirals. There are some antivirals that seem like they're doing some pretty impressive work.
Oh, she...
Yeah, I already tried letting her out. She gave me a look.
She is so dramatic.
She is dramatic.
Let her out.
Keep talking then.
Okay. What do you mean keep talking then? You act like you're going out of the room to let her out. What? Well, you just smacked her with the door.
No, she smacked me with her ass.
Oh, no. Well, you smacked her with the door. That's why she smacked her ass into your face.
No, she smacked me in the face with her ass, and I accidentally hit her with the door.
That meme with
the Shiba,
is hilarious because that's exactly how they are.
Fucking priceless.
That breed of dog is just... Although she's been comic relief through this.
Oh, 100%.
But I know animals are going through this. There was a woman up at Sheetz today, and she had a huge dog. I don't know what kind of a mix this dog was, but it was black, and it sort of looked like a lab, but it was like almost like this, like as big as a Saint Bernard or something. Like this dog was humongous, and she's like, this poor dog's been cooped up. She just wants to go. And, like, dogs are feeling it, too.
Oh, 100%.
You know?
But this is why I am grateful that we do have a dog. She's going to be some sort of relief for us.
Right.
It's just shit that they have to be impacted heavily by this, too.
Yeah, because if we all get sick, we're all going to be sleeping a lot, I guess. Well, I'll be dead.
Hey.
Well.
Again, I hope it hits me the hardest.
What?
I hope it hits me the hardest.
Why would you wish that on yourself?
Because I know we're going to get sick.
Why don't we just hope that we don't get it at all?
We're going to get it.
I don't know. I can't judge. I mean,
for all we know, we could be asymptomatic, all three of us.
What, have them and not get anything?
And not have any symptoms whatsoever.
I don't know. I have been beefing up on the immune support, so hopefully
it's been in our community for at least 2 weeks now.
Okay, what's that have to do with anything?
I'm just saying it's more than likely we've came in contact with somebody who potentially already has it.
Well, they'd have to come to me.
Exactly, but gotta remember, it was a 19-year-old that was taking up the isolation unit at the hospital. So that means that little fucker was probably around their friends, which means their friends were probably around people that are from our area.
Probably.
So therefore, through chain of infection, we probably have already been exposed to it.
Well,
not to mention we serve medical staff.
Well, yeah.
So
I know. So I mean, it's like, I think I'd be more surprised if I didn't get it.
I mean, hey, just like the one tweet I told you about 3 months ago, we were getting called low-life employees, and all of a sudden we have to uphold the public.
Oh yeah, well.
Turns out we're not so low-life, are we, huh?
Yeah.
Turns out we're pretty fucking essential.
Don't get me started on the essential versus the convenience again,
I know,
please.
we're not going to go down that.
Yeah, because I just feel like anyone that has to work in the food service is just a sitting duck.
Yep.
And that every time someone comes into our store, they're just exposing us more and more and more. And I don't know, I just don't find it fair. And then the people that can stay home because their companies allow them to, or their job allows them to, they think they're safe, and they're not, because if they have someone in their family that works in the food industry or in the healthcare industry or a first responder or what's the other ones I'm thinking, like police or whoever, they're not safe anyway, because we're still having to deal with the public, and the public won't listen, and there's too many people out, and there really is no reason for these people to be out the way they are.
I'm trying to look at it from a moral or from a more positive point of view, as like, yes, we're exposed, and it is just such dog shit and is wrecking my anxiety, but at the same time, we get to uphold the public.
Why do you find that something that's great?
Because it feels good knowing that we're considered as essential.
No.
To functioning society, we're considered essential.
No, I don't agree with that at all.
I just where
I think of helping people.
Where I get annoyed is where people don't follow the rules.
Oh,
where there's too many people in, where they're not separated far enough.
Yeah, no one seems to care about social distancing.
Like even when you go to grocery stores for essentials, they're not separated.
No, nobody cares.
That's
and
what
they're
I mean.
slobbering all over each other and laughing and thinking this is a gosh darn national holiday or something. Like, this is serious shit, people.
And a lot of the teenagers are like that too. It's not really millennials.
100 million plus Americans under stay-at-home orders. That's ridiculous.
Yeah.
That's almost half of our country.
I mean, we have roughly 352.
Okay, well, it's getting close.
So
that's getting upwards.
It's about a third.
Yeah, it's getting upwards there.
Yeah.
Yeah. I don't know. We can't work from home, so...
Nope.
I can't even talk about any new movies or anything because nothing's open.
That's what I mean.
Like literally the only thing on the news, like the latest up to date is the virus. Like, that is all there is to talk about.
Shit.
I'm just getting tired of this.
Getting really tired. Everyone is. Everyone's going to get cooped up. Everyone's going to get stir crazy.
Yeah, but a lot of people didn't know about this at first, but you did. And so I've been thinking about it since December.
Just something in my gut said just follow it, follow it, follow it.
Well, you were
right.
It
just didn't sit right with me.
Oh.
The way it was being maintained over there, the way it was being handled, how secretive they were about it, it just didn't sit right. And I knew it was going to somehow escape. And it did.
Yeah, it sure did. Oh, did it ever? I mean, it's just...
I know I'm healthy. It's just that there's always that small chance.
How many healthy people have gotten infected, Michael?
A lot.
Well...
But the thing is, a majority of the people in hospitals right now, due to coronavirus, are from 20 to 44 years old. They're millennials. We're taking up a majority of the hospital space.
How?
And that's wrong.
But how?
Because we kept going out to bars and clubs.
Well, it was also, they were also saying that it wasn't hitting you people. So everyone in that age group.
Everyone was too busy paying attention to the old people, which is to be expected.
Right.
There wasn't enough coverage on the younger generation.
But they were saying that it wasn't hitting them.
It's not. It's not killing us. I mean, it's killing some of us, but it's not killing all of us. What they're finding out is the ones that do succumb to high amounts of pressure, shortness of breath, and pneumonia that 20% of people roughly get with the infection, they're experiencing permanent scarring inside their lungs.
So that's what it's hitting, 20% of the ones that get it.
Well, no, it's 20% of people will get pneumonia. I don't know what the percentage is who will have permanent lung damage. You have your different ranges of pneumonia where you have mild pneumonia to severe.
So only 20% of these people are getting the actual pneumonia.
Yes. That's why it's really only killing people with underlying health conditions. However, it is killing healthy people. It's killing doctors. It's killing nurses.
Well, I think the doctors and nurses are being killed over that because they're right in the line of fire.
They're exhausted, too.
Well, they're exhausted, so their immune is down. When you're exhausted and you're tired, your immune system goes down so fast.
That's what I mean. So they're just constantly exposed to it.
Yeah, they're not because...
They also don't have time to rest when they get infected.
Exactly, and that's the problem. These people can't keep doing that. They have to rest.
Not to mention, I talked to an ICU nurse about this on why it's going to throttle the medical system. So the way they treat this is the same way they treat TB, tuberculosis. You need a negative pressure in the room to negate the pressure building up inside the lungs. What they're doing in Italy, because they don't have any isolation space whatsoever, is that they are literally putting their patients in this bubble around their head. And what it does, it depressurizes it, and it allows them to breathe easier because there's less pressure on the lungs. However, we're not to that point yet. So the way to do mass isolation is to have that one isolation unit door that is supposed to be sealed in shut because the air has to be purified since this is droplet and airborne. That door has to remain open. And then you seal off certain sections of the ICU, thus creating a mass decompression
Then why aren't they doing that?
They are. They have to. The problem is that when you do this, you're in a full-blown hazmat suit Our nurses don't have that capability. They're breathing in that infected air without any protection, and they don't have a choice.
That's not fair. That is
while they're sitting there filing paperwork, they are breathing in contaminated air.
And masks won't help them.
No.
What about respirators?
Not enough.
Oh my
God. Respirators have to go to the patients that are suffering.
That is absolutely 100% heartbreaking.
Well, hospitals aren't equipped for pandemics. No hospital is.
But we're going to lose half of our medical staff.
In Italy alone, there are roughly about 5,000 medical staff infected by the coronavirus.
Out of how many?
I don't know.
Well, that's what you want to find out.
But 5,000 medical staff is a big fucking number.
Well, yeah.
Especially here in America if that happens here, because there's a shortage of medical staff.
My God, this is just such a disaster.
We're going to lose young medical staff due to exhaustion.
This is so terrible.
So the government called upon universities and stuff like that to continuously pump the medical field full of nurses.
Well, they can't do it right now.
But online you can. There's still online courses going on. Colleges are still in session just online.
Yeah, but not everybody wants to be in the medical field.
I know, but the problem is that they may expedite their training. They may get overwhelmed and they may just quit.
Or some people are going to see what this is doing and say, screw that, I'm never doing that. This could get really bad for a lot of years.
No. The reason why they're saying roughly fall or springtime of next year when this is supposed to go away is because they should have a vaccine out by then. That's what they're hoping. That's why this isn't going to go past 2 years, really. Oh. If anything...
It's already been too long.
Worst case scenario, it'll be next summer by the time that everything is lifted.
I don't know.
Summer of 2021.
This is just ridiculous.
But we're better off getting it right now before next flu season hits.
I can't believe that this has come about and just how bad it is.
I can. Humanity, it's a part of human nature. It's a part of human life. Pandemics are a part of nature.
Yeah, but why did it have to be in our lifetime?
It seems like it's on a 100-year cycle.
Well, I won't be around for the next one.
I hope not.
I hope not too, because then it'll be 150.
Some people, this is their second pandemic, like worldwide pandemic they're going through, like of this severity.
There can't be that many people left.
Some people were born before the Spanish flu.
Oh, wait, what was the 1918 one?
The Spanish flu.
Yeah, well, that's really old. No.
102.
That's 102. There's not hardly anyone left like that.
You'd be surprised.
No,
They just showed someone's birthday on the news. She was turning 100. She was born in the middle of the Spanish flu.
Wow. That's pretty impressive.
There have been 2 prior pandemics prior to this, though. And why don't I remember swine flu being this bad? Apparently everyone's saying it was really bad.
That's what I keep saying. That's what I keep hearing too, and I do not remember it being that bad. Like, I certainly didn't worry about getting it.
Did we get sent home from school from that?
Michael, I don't remember. I really
don't
remember.
Because I was in the 7th grade.
I don't remember.
It's my fucking fun.
I don't remember ever worrying about getting it either.
That's what I mean. Like, I never worried.
No. I don't know. Maybe I just wasn't paying attention.
Yeah, are we that out of it?
No, I just think because, like, I don't even know anyone that got it. Or no, did we say 2 people? You knew 2 people.
I knew about 2 people. So, okay. The reason why we don't remember it being as bad is because it infected roughly 50 million Americans. That's a lot of people. Don't get me wrong, it's still a lot of people. And it killed 10,000. But
was that worldwide?
Yeah. No, that was just America alone.
Okay, that was just America. This is worldwide.
No. Swine flu was worldwide, but those numbers were just America alone.
Oh.
But we're already at like 33,000 infected already.
That's infected.
And we have roughly 400 dead.
Okay, they had 10,000 dead. That's a lot of people dead.
But we're just starting this, though, is what I'm saying. This is only the beginning.
Yeah, that's just a disgusting way of thinking about it, isn't it?
I'm not even going to discuss what's going on in Italy.
These numbers are people's lives.
Yeah.
Like, if I... See, this is what kills me about the older people coming into the store as much as
that
they
are being out and disregarding social distancing.
I don't want to make it all the way to my 80s just to be taken out by a freaking stupid flu that I could have avoided, but just by staying home if I hadn't been such an asshole. You know what I'm saying? That's not how I want to be taken out.
I mean, the way one of our coworkers put it is...
Unless they want to. It's an easy way out for them.
That's the way one of our coworkers put it. Hey, I lived a good life, may as well.
How many people that don't want to be here may be thinking the same thing? I didn't even think about that. Hey, maybe if I get it, I'll go.
But if they watch the news and pay attention, that's not the way you want to go.
No, I don't want to be smothered.
It's a slow, agonizing death.
Okay, stop. I don't want to talk about it or think about it.
I know, that's why I said I'm not going to get into
That's what scares me the most, especially because I'm a smoker. And you have me convinced if I get it, I'm going to be dead.
No.
You don't know.
You should be very cautious, though.
No kidding. But now, like, I know...
There's a reason why they're shutting down the tobacco plants.
Why? That's still not going to stop us from Now I'm stress smoking. So instead of quitting, I feel like...
you're not going to have any left to smoke is what I'm saying.
They're not going to be out of cigarettes. There's no way. People wouldn't make any money. Are you kidding me?
Tobacco plants were deemed non-essential. They have to shut down.
Well, beer's non-essential too. Why haven't beer distributors been shut down? Why just liquor stores?
I don't know. I'm not a politician.
You know, and if you're locked down because everyone else is sick and you're not sick, you can't even have any fun because you can't smoke or drink or anything. I mean, I'm not saying that that's what I want to do. Christ, if that happened to me, I'd be like, just put me to bed.
Mm-hmm.
I learned how to be lazy real well when I got laid off.
I don't know.
I learned how to sit there and watch TV and just do it for hours because there's absolutely nothing else to do because your arm is in a sling and you just lose your job. So, yeah, I learned how to be lazy real quick. But that really wasn't being lazy. That was trying to heal from my arm.
Yeah, really.
I don't know, whatever. You know what I mean.
I know what you mean.
Anyways.
All right. Yeah, it's going to collectively take us... Yeah, we're at 23 minutes. Relax.
Yeah, okay.
It's going to collectively take us... together, one giant sacrifice as a society. We're just gonna have to suck it the fuck up and do it.
Do what?
Anything we have to.
Yes, I know that. We have to listen. Okay, you don't have to say that over and over. That's what we're doing every single day when we get up and go to work.
I'm just making discussion. What the fuck? I'm not saying you in general, asswipe.
I know that, but it's time to wrap it up. I'm done talking about this stupid virus.
All right. Well, just anything funny this week?
No, but I can be pissy about one other thing.
What?
What the hell's up with the weather?
Yeah, it was like fucking 70 on Friday. Now it's like...
And now it feels like it's going back into winter again. And it's wreaking havoc on my sinuses.
Hurt.
And my allergies. They hurt. And it always feels so damp. Like, like damp cold, not just cold. And it's just like chill. It just goes right through you. I can't
wait for it to be warm again.
I can't wait till no one says the word coronavirus in every sentence.
We changed the subject and you just brought it right back up.
No, that's all right. We're done anyways.
That was your fault.
Whatever. That's about all I have to say, so I'm leaving it at that.
You all right?
Yeah, no, I just got a sharp pain in my head.
All right, well, we're going to wrap it up then.
Whoa, yeah, gee, that's okay. My mom might be dead in 3 minutes, but we're just going to wrap it up. Later, bye.
Later, bye. What the
so caring.
Fuck.
You're the whatever you were saying.
Well, you better be. Oh, no, you're going to say it now.
Huh?
I'm not going to say it now.
Not going to say what?
I'm not going to say it.
You just said it.
Because you're going to be all paranoid if I say it.
Just go. Just try to stay safe, everyone.
It's your freaking allergies more than anything. It's probably what it is.
What?
Your head hurting?
No, it went away already.
Oh.
I don't know what it was.
Were you trying to think?
Maybe that's what it was. Yeah, I was trying to think of another topic other than the coronavirus, and that's what happened.
Nice.
It was almost like lightning hitting, almost like where my like plate is that should be in my head, where there's no brain. You know, like it would hit the plate. I know what I'm saying. Never mind, you're out of it. You've been out of it.
Out of it? You need to go to a hospital. You think you just had a stroke.
I ain't going anywhere near a hospital, thank you.
Yeah, it's gonna suck. Perhaps if you like break something, you have to go to the hospital. You're just like, oh, cool.
I'll tell you one thing I would not want to be right now is pregnant. You have to go to the hospital, and you're going right into the line of fire to bring a newborn into this world.
Not to mention my cousin is pregnant and a nurse.
Gee.
Really?
Oh, that's right. I forgot.
Yeah.
No, I would not want to be pregnant at this time of my life.
And she's a nurse?
No, thank you.
They may
in the hospital.
They may kick her ass
They could have.
off.
Yeah.
And put her on maternity leave until she has a kid.
Oh, you never know. All right.
But yeah,
let's wrap it up.
Try to stay healthy, stay clean, wash your hands, stay away from people, keep your distance. Don't be a bunch of fucking dickheads. Just listen to your governments, please. We'll get over this together. We don't know when we'll be back. It could be 2 weeks, could be next week. Just keep that in mind. Whoever listens to this, I know it's like no one, but hey, whatever.
Oh, wow.
All right.
Good night,
Stay safe, everyone.